welcome to the third and final panel of Expanding Empathy 2025. Um, I think many of you are here for some of the earlier sessions in the first two this semester. This is the seventh year we've been doing the Expanding Empathy. We started back in 2019. Um, and yeah, seventh year. And it's the goal of the series is to encourage people to have interdisciplinary conversations about empathy, ethics, and moral decision making. Over the years, the format has evolved and changed, and what we've done, especially in the post-pandemic era, is to flip to this virtual format, which allows us to bring in folks from around the world to talk about these topics and converse with each other. This is hosted through the Consortium on Moral Decision Making, an interdisciplinary network of folks based out of Penn State that cuts across the social sciences and the humanities to try to understand ethics and morality from a cross-disciplinary lens or set of lenses. That is supported by the College of Liberal Arts, the Rock Ethics Institute, where I'm a faculty member, the McCourtney Institute for Democracy, the Department of Philosophy, the Department of Psychology, and the Social Science Research Institute. And so we really appreciate their support. So far in this series, we've had a couple of great panels already with Philip Kanska and Lita Berrio starting us off the first panel on unpacking empathy and its components, trying to understand what it is and how it works, and also thinking about this in the context both in human to human interactions, but also human AI interactions. And Dr. Berrio had a really nice presentation about how that can help us gain self-insight through narrative construction. I think some of the AI empathy pieces um, connect with some of the past things we've hosted through the consortium, but also will foreshadow some of the things that I believe Dr. Valerie Tiberius will get to in part of her talk a little bit later. Um, Last week, we talked with Sarah Conrath and Fritz Breithaupt about the bright and dark sides of empathy and the value of empathy and what it means to have these encounters. And I think that Dr. Simone Shamay-Tsoory's talk on adaptive empathy and the value of learning from empathy and the two-way street, the dyadic nature of empathy, will nicely complement some of those discussions as well. So, the format, each speaker will go about 30 to 45 minutes or so with a time for a few questions afterwards. Those of you who are in the audience, please just drop any questions you have in the Q&A at the bottom, and I'll curate those. We'll try to get to those questions afterwards. Any clarification questions, follow-ups, and so forth, just drop them in there. And then we'll save some time at the end for some back and forth discussion where we'll try to draw some connective threads across the two presentations and take any further questions you have. So let me briefly introduce both speakers. So Dr. Simone Shamay-Tsoory is a professor of psychology at the University of Haifa. In her work, she focuses on understanding neural mechanisms that underpin social behavior, especially empathy, where she and her lab have published quite a lot of work on this topic. Um, some of the particular questions their group is focused on include things like the cognitive and emotional consequences of different brain pathologies, including developmental pathologies and acquired pathologies. Um, Also looking at emotional and cognitive brain functions in healthy individuals using brain stimulation, neuroimaging. Um, some of the questions they focused on include things like how do people understand emotions? What are the neural underpinnings of empathy, social communication, and interpersonal synchronization? She and her group have published in a wide variety of top journals in social neuroscience and psychology, including social cognitive and affective neuroscience. Some really interesting recent work I noticed, including publications in Psychonomic Bulletin and Review on subcortical regions and affective empathy, a paper on moral alignment from interbrain synchrony in communications biology, um, one that I literally printed out to read later today on social effort in neuroscience and biobehavioral reviews, and then one in emotion on how it takes two to empathize and interbrain coupling and this role in distress regulation. She and her group have a grant from the European Research Council to look at interaction-based learning and interbrain plasticity. And I think As I mentioned earlier, her work on adaptive empathy and how we learn from our empathic encounters with other people is really quite interesting for discussing the broader value of how we appraise empathy, how we think about how it's situated in interactions with people, and how we learn about how it's good or bad or constructive in different contexts. Our second speaker is Dr. Valerie Tiberius, who's a Paul W. Frenzel Chair in Liberal Arts and Professor in Philosophy, University of Minnesota. Um, I actually just learned in looking at your CV that as a fellow PhD from UNC Chapel Hill, so go Tar Heels. I did my psych PhD there a long time ago. Um, and Valerie has a number of really interesting and intriguing books, including what her most recent one is What Do You Want Out of Life? A Philosophical Guide to Figuring Out What Matters. Um, a lot of her work focuses on well-being and questions from virtue and well-being literatures and what it means to live well. Um, so how people think about their lives, reason about their lives, and she talks about this in a book called The Reflective Life, Living Wisely Within Our Limits, discussing what it means to have reflective wisdom in light of our psychology. Um, the book Well-Being as Value Fulfillment focuses on a theory of well-being that she's laid out both there and in several interesting papers that connect across psychology and philosophy. Um, and as she puts it in the book, how we think about well-being deals with how we try to pursue, fulfill, actualize our values over time. One thing that's really interesting from my perspective too, I think she's published in a lot of really interesting psychology journals like Perspectives in Psychological Science, Journal of Research and Personality, and has a paper Value Fulfillment from a Cybernetic Perspective in Personality and Social Psychology Review. Um, and lastly, she's also part of the Moral Psychology Research Group, a conference for which we hosted in November 2024. A really fun group of psychologists and philosophers who get together and talk about ways to push the interdisciplinary study of morality and ethics forward. So, without further ado, let me turn it over to Dr. Shamay-Tsoory, and we'll get started.
So good morning to everyone. It's afternoon here. So I thank you for the invitation. And today I'd like to share with you a few insights from our lab about empathy and the neuromechanism that underlie empathy and basically our work on how two brain communicate during empathic interaction. And the new approach that I present basically views two brains during interaction, performing empathic interaction, and we see how instead of looking at one brain as involving a unit with multiple network, we can see two brains as an extended neural network involving both intra-brain connection and interbrain connection, and we will try to see how these interbrain connections underlie empathy. So first, when we start to define empathy, there are many different definitions of empathy. Some definition of empathy view more affective and emotional aspect of empathy, like emotional contagion. And other definition of empathy focus more on the cognitive aspect of empathy, like perspective taking. And today there are more hybrid models that view empathy as both involving cognitive and emotional aspect. And we know that empathy occurs almost in every social interaction. When we share the sadness of a friend, when we share the joy of friends or groups, we see empathy throughout the lifespan. We see it in children, in adolescents, and across the lifespan and across many situations, we can see empathic interactions emerging almost in all interaction. We see it also in the animal kingdom. There's evidence for empathy in chimpanzee. Even in rodents, we see that a nice paradigm showing that rodents are able to sense the distress of other and free them if they are locked in this maze. So given the importance of empathy and its prevalence in our daily life, the question is how to examine the neural underpinning of empathy. And until today, the vast majority of neuroimaging experiments examine empathy in fMRI, for example. So this type of experiments involve isolated participants. They are lying in the fMRI scanner. They are carrying out artificial tasks, for example, using a computer screen in a sensory and socially deprived environment that only remotely resemble the real face-to-face interaction that you usually see during empathic interaction. And I think that there are two fundamental limitations in most traditional paradigm of empathy. One is person-dependent limitation and one is situation-dependent limitation. The person-dependent limitation revolves around the limitation of the movement. When we limit the ability of the participant to be an active agent in the situation, we limit the basic tendency to act upon and feel embodiment during the situation. So it can actually interfere with the basic empathic processing. The situation-dependent limitation is revolve around the artificial context that most experimental conditions have, where we use artificial tasks with no real face-to-face interaction, and that only remotely resemble the face-to-face interactions. And it's very difficult to interpret how data collected by this system can relate to core features of empathic behavior. So in traditional paradigm, we see usually a computerized task. So empathy is viewed as an open loop. Okay, there is one participant, the target, experiencing some distress, and then we see an empathic response. However, if we test real face-to-face interaction in the lab, perhaps we can have a feedback loop. There is a distress experienced by the target, then an empathic response experienced by the empathizer. And this response is perceived by the target. And this response, perhaps when it is perceived, it can directly regulate the level of distress of the target. So basically, in face-to-face interaction, we have this feedback loop that develops between participants. There is this mutual alignment that can develop between the participant, and perhaps the mutual alignment between them in emotion and gestures and facial expression is also represented by synchronized brain activity. And synchrony is a behavior that is seen across the animal kingdom. And this is a very nice clip that I found demonstrating synchronized behavior in sheep. Okay, so I hope can you hear the sound? No sound. Okay, so even without the sound, I say that it's a very impressive behavior that we see in many herds. And this remarkable marvel that make tens of even thousands of separated elements gather into an assembly that takes a life of its own is observed in numerous life forms, including herding sheep, swarming ants, flocking birds, and even in fish. And humans also tend to synchronize. When we walk together, we synchronize our steps. When we dance, we synchronize our body movement. And even unconsciously, when we talk to someone, we synchronize our postures. And in a recent model, we suggested that all types of alignment, from motor alignment to emotional alignment to cognitive alignment, are actually representing a core alignment mechanism. So we argue that people have a general tendency to align their behavior, and it occurs in a motor level, in emotional level, in a cognitive level, and they all represent our basic tendency to align, and these levels are connected. For example, if we manipulate the motor level, we can also affect the emotional level and the cognitive level. And all those three levels of alignment, we believe, are mediated by shared neural networks. And there are at least three neural networks that support all those types of alignment. One network is the alignment reward system. So these are a network of regions that are activated during rewarding activities. And indeed, being connected and being part of the group during synchronization is rewarding. So if we observe this nice example of herding sheep, we see that being in a herd is very rewarding, and also observing herding is rewarding, because we all very much like to look at herds and observe flocks of birds in the sky and schools of fish. So herding is rewarding, and because, well, we like to be connected, it is rewarding to be part of a group. Now, another system is the misalignment distress system. So once we detect the gap between ourselves and the group, there is this a group of brain region, like the dorsomedial prefrontal cortex and dorsal anterior cingulate, that is activated when we are separated from the group and we detect the gap. And a very important neural network is the alignment observation execution system. And it includes the inferior frontal gyrus, the IFG, inferior parietal lobe, premotor cortex. These three regions are part of the observation execution or mirror neuron system. Basically, the mirror neuron system are a group of mirror-like neurons that tend to be activated both when we perform or execute an action and when we observe an action. So these regions are like mirroring the environment. So these regions are activated once we detect the gap between ourselves and the group, and we seek to close this gap and be part of the group. Now, in recent years, it has been found that this region, particularly the mirror neuron system, the IFG, are not only active in one brain while trying to synchronize with other people and trying to connect with them. These regions are also coupled between brains during social interaction. So this new approach, termed the two-brain approach, suggests that during social interaction and during interaction that involve empathy, we can observe not only connection between region in one brain, but also connections within brain. These connections are basically correlation between brain activities. So it's not real physical connection. They are co-activation of brain region during social interaction. So the intra-brain connections are probably mediated by physical connection, but those inter-brain connections are mediated by sensory input. And it has been shown that the extent of this inter-brain connection predict level of connectedness. So when we see high level of inter-brain synchrony, we usually see high level of connection, better cooperation, more pro-social behavior. So more and more studies in the field of social neuroscience shows that those interbrain connections are excellent marker of connectedness between individuals. So in the context of empathy, perhaps we can view the interaction between the target as an empathizer as a feedback loop involving communication of distress. So for example, the target is experiencing distress. They communicate their distress. It could be verbally, it could be with facial expression or emotional prosody. And then these cues are perceived by the empathizer. And once they are perceived, the empathizer respond to this cue. For example, they can mimic their facial expression. They can provide some comforting touch or provide support, verbal support. And once this support is perceived by the target, it can affect back the target. And when those processes occur simultaneously, for example, when the target communicate distress and simultaneously the empathizer perceive this distress and all these processes occur simultaneously, this is when perhaps we can see increase in interbrain coupling. And when we see this increase in interbrain coupling, perhaps it means that this feedback loop is working and we see better emotion regulation during this situation. So in order to investigate this proposed model, we looked for an empathic response that would have a direct effect on regulating the targets. And we, in the first experiment that we carried out in this set of experiment, we examined the effect of comforting touch. We know that comforting touch is a powerful empathic strategy for emotion regulation. Touch is used in humans. It's used also in chimpanzees. For example, in this very nice example from the book of Francis de Waal, we see this example of consolation where juvenile chimpanzees put their arm around an adult chimpanzee who was just defeated in a fight. And it has been shown that this touch behavior, comforting or consoling touch, is known to reduce the level of distress of the target. This behavior was also observed in bonobos, also in elephant. There is evidence of touch related to consolation, also in rodents, and of course, across the animal kingdom, we see many examples of touch used to comfort during distress. And in humans, we carried out several experiments, and we found that the most powerful strategy for emotion regulation using touch is hand-holding. So we decided to focus on hand-holding during empathic interaction. And Pavel Goldstein, my previous PhD student, decided to examine the effect of touch on pain regulation, and to examine whether interbrain synchrony predicts the level of pain reduction during empathic touch. So what we did in this experiment, we recruited romantic couples, and they were divided into roles. One was the target, and the target was inflicted with pain using a thermode attached to the arm, and the other one was the toucher. And the toucher was instructed to provide touch during the interaction. And we basically had a 2-by-2 condition. We had a touch condition, no touch condition, pain condition, no pain. Okay, so it was a 2-by-2 design. And we measured their brain activity simultaneously. We focused on the alpha mu band. We used EEG in this experiment. And we focused on the alpha mu band because this band was previously suggested to underlie empathy. And we collected the alpha mu band from both participants, and we measured correlation using the circular correlation approach to measure correlation between their brains during the pain and no pain condition. Now here we can see a summary of the results, and each line here between the brains represents a significant correlation between the brain. So as we can clearly see, the highest number of links between the brains, significant links between the brain, is observed in the comforting touch condition. So we had no touch, no pain condition, touch, no pain condition, no touch, pain condition. We see that in all those conditions, we had fewer number of links, fewer number of significant correlation between brains. And the highest number of correlation was in the comforting touch condition, indicating that when there is touch and pain, there is high level of brain-to-brain connectivity. Then we wanted to see whether these brain-to-brain connections predict level of empathy experienced by the empathizer. And we found that the level of brain-to-brain synchrony predicted level of pain resonance, level of how much they felt empathy, the empathizer felt empathy toward the target. So we see that this brain-to-brain synchrony actually represent the level, the extent of empathy that the empathizer experienced toward the target. And I think that the most interesting finding of this study is that the level of interbrain synchrony predicted the level of pain predicted by the target. So it means that when the couples were synchronized, the level of pain experienced by the target reduced. Okay, so when we have a partner with high level of empathy and there is high level of interbrain synchrony, then the chances that the pain will reduce are higher. Okay, so we see that interbrain synchrony is like a mechanism for reducing pain during empathic touch. And the question is, what happens during this touch experience? It's possible that there is some blurring between self-other boundaries. It's possible that during the touch, the empathizer is able to better sense the level of distress experienced by the target. But we see that interbrain synchrony is a critical component in reducing distress during empathic interaction. Then we wanted to follow up this experiment in another context, in the context of emotional pain, because we wanted to see whether we can generalize the finding to emotional pain compared to physical pain. We also wanted to examine dyads that are not romantic partners, and also to look at other responses, not only touch-related responses. So this experiment was carried out by Yarden Avnor, my PhD student. And in this experiment, we used FNIRS. These are cups with electrode that measure basically brain activity like fMRI. And we wanted to examine interbrain synchrony during emotional sharing situation. So basically in this experiment, we asked participants to share with a stranger a high intensity emotional situation, a distressful situation that occurred to them in the last year. And we also had a control neutral condition where the target verbally shared with the empathizer just a everyday neutral event. And we wanted to look at their interbrain synchrony during those conversations and to see whether the level of interbrain synchrony would predict emotion regulation and reduction in distress following the conversation. So for example, of a conversation, for example, we see the targets telling a story where they lost their grandparents a few years ago and that it was very distressful. And the empathizer was encouraged to respond freely. So we respond with empathy. And this is an example of emotional sharing. In the neutral sharing, they just tell a story and how they arrived to the university. They took the bus and missed the bus and took another bus. So it's a more neutral story. So basically the design was like this. Oops. So there was either a neutral or an emotional story, and it was counterbalanced. And then they had a few minutes of a washout period just to regulate their emotion before the condition. And we measured the level of sadness before the story and after the story. Okay. So then first we looked at their emotional state before and after the story. We looked at the emotional state of both the empathizer and the target. So the target here is in orange, and we can see that the level of distress of the target decreased following sharing the emotion. So we see that it takes 5 minutes to recount a story, and we see a reduction in level of distress. And remarkably, we saw that the opposite trend appears in the empathizer. The empathizer had lower level of sadness, but after listening to the story, we see increase in their level of sadness. Okay, so we see this emotional convergence occurring between them during 5 minutes of conversation. So we take two strangers talking for 5 minutes, and in 5 minutes they become converged. One was sad at the beginning, then his sadness reduced, and one was neutral, and their sadness increased. Actually, we saw also some convergence in the neutral stories, but it was much less because to start with, they did not have any sadness. So, and the effect was smaller, but it's very remarkable to see that after 5 minutes on conversation, we see this emotional convergence effect. We also looked at whether empathy would predict this effect of emotional convergence, and we found that participants who felt higher level of empathy during the conversation showed a higher level of emotional convergence. So if you feel high empathy toward your partner, you will tend to converge more than if you don't feel empathy toward the partner. And another interesting finding was that the level of empathy experienced by the empathizer predicted the level of sadness of the target. So when the empathizer felt high level of empathy, directly had an effect on the target, and their level of sadness reduced. Okay, so participants with high level of empathy are better at regulating their partner's emotional sadness or emotional distress. Then we looked at their brain activity. We focused on the inferior frontal gyrus, which is part of the mirror neuron system, as I mentioned before, because this is a region that we see in many studies that tend to synchronize between participants. And we wanted to see whether interbrain synchrony in this region, in the IFG, would predict reduction in negative affect during the conversation. So indeed, we found this effect in the IFG, but also in the dorsolateral prefrontal cortex, which is another region in the frontal lobe, which is related to emotion regulation. So we can see here a negative correlation, indicating that high level of interbrain synchrony predict lower negative affect. So when there is high level of interbrain synchrony in the dyad, there is higher reduction in negative affect of the target. So again, we see this effect that showing that when the dyad is synchronized, the negative affect reduces. We see similar effect in dorsolateral prefrontal cortex. So if we go back to our model, we see that indeed, when this feedback loop works simultaneously, we see a nice reduction in the negative affect of the target and faster recovery and faster regaining homeostasis. So we see that this interbrain coupling effect is shown repeatedly, and it has an effect on connectedness, and it contributes to empathy. And the question whether this interbrain coupling is plastic, because we know from neuroscience that the brain is plastic and changes following experiences. Studies on neuroplasticity focus usually on experience-dependent changes occurring in synapses and brain structure and functional network. And the question is whether also this interbrain network change, whether brain-to-brain connection are plastic and can change following repeated interactions. And it is possible that in a similar manner, the region in the same brain change their connection during learning, perhaps also connection between two brain change following repeated social interactions. And the ability, and we coined this term interbrain plasticity, as it represents the ability of interbrain networks to reconfigure in response to interpersonal interaction. So for example, before people meet, they have no interbrain coupling, but once they meet for the first time, we'll see emerging interbrain network that develop. And then after multiple sessions and multiple meetings, we'll see high level of connection that are established between those participants. And in order to examine this concept of interbrain plasticity, we wanted to focus on a unique interaction that is characterized with empathy. And this is the context of psychotherapy, because psychotherapy is a unique context where empathy is the core strategy of healing. And the therapist uses empathy to treat the patient. And we wanted to see whether interbrain plasticity could contribute to better outcome of psychotherapy. So the aim of this experiment, it was carried out by Dr. Haran Sened, who's a postdoc in my lab. And he's a clinical psychologist, and he was interested in examining whether changes in interbrain coupling over the course of multiple sessions would predict better outcome of psychotherapy. So we started with a pilot study with 8 students suffering from state anxiety. And we used the psychotherapy for test anxiety that it is a short-term psychotherapy of 6 sessions, and it is based on imagery-based treatment protocol for test anxiety. And we created in our lab this small psychotherapy room setup with, we had those couch and tissue and everything. And we recruited students that reported suffering from test anxiety, and we had an initial assessment and screening. And then they came to the lab to 6 weekly meetings, and we used FNIR to scan their brain simultaneously with the psychotherapist. So we scanned both the patients and the psychotherapist in meeting 1, 3, and 5. And then we had a follow-up interview to examine whether they experience a reduction in the level of symptoms. And we focused again on the IFG, the inferior frontal gyrus, a region that is part of the mirror neuron system. And we found in this study, although it was a small sample, we found a nice increase in the level of interbrain coupling from session 1, 3, and 5. Okay, the highest reduction was from session 1 to 3, increase. So we see this increase in interbrain synchrony. So this is first evidence that indeed interbrain plasticity exists, because we see that following multiple sessions, we see increase in interbrain coupling. Then we wanted to see whether this interbrain coupling predicts a reduction in level of test anxiety. And indeed, we found that the extent of symptoms of test anxiety were predicted by the change in interbrain synchrony. So the higher the change in interbrain synchrony, the higher the decrease in symptoms of test anxiety. So we see here that indeed interbrain coupling, the interbrain synchrony and the change in interbrain synchrony predict the level of outcome of the therapy. In another study, we wanted to replicate the finding on major depression, because major depression is a situation with high level of symptoms that include also social risk factors. People that suffer from depression also show social impairments, poor social functioning. They have social anhedonia, they have decrease in their social interest. And we thought that perhaps examining whether psychotherapy of patients with major depression would show whether interbrain plasticity also predict improvement in their symptoms. So in this study, we had 20 patients diagnosed with major depression, and we had 2 psychotherapists, and we had 16 therapy sessions. And we found that indeed across all sessions and across all patients, level of interbrain synchrony predicted reduction in depression scores. So higher level of synchrony predicted a reduction in depression score. We also found increase in interbrain synchrony during between sessions. So we see from session 1 to session 15, gradual increase in level of interbrain synchrony, suggesting again that interbrain synchrony is plastic and changes and develops throughout multiple therapy sessions. So we concluded here that indeed interbrain plasticity can occur during multiple interactions, multiple sessions, and that the level of synchrony predict the treatment outcome. So if indeed interbrain synchrony is something that we can train and something that is plastic and can change over learning, over repeated meeting, the question is whether we can directly train 2 brains to increase their level of synchrony. So in order to directly train brains to synchronize, we developed a new technology that allows driving causal inferences between interbrain synchrony and behavior. So we used here a dyadic neurofeedback platform, where basically we connect two participants to the FNIR system, and they are trained to increase their interbrain synchrony in real time. So basically what happens in this session is that we bring dyads to the lab and they observe a screen. And in the screen, they observe a fish on the screen. And they are told that the level of velocity of the fish, how they swim, the velocity of the fish represent the level of interbrain synchrony. And they are instructed to try to make the fish swim faster. Okay, so the system works like that. They are connected to FNIRs, and we calculate the level of interbrain synchrony in real time. And once the level of interbrain synchrony increases, the fish start to swim faster. Okay, so here the fish doesn't move so much, so it means that they are not so much synchronized. But once they start to synchronize, the fish start to swim faster. So we wanted to see whether participant can learn how to increase the interbrain synchrony and whether it translates into better connectedness between them and better empathy between them. And we also had a control condition where the velocity of the fish is not related to the level of interbrain synchrony. It is just a velocity of fish that was recorded from previous participants. Okay, so here we see that it starts to swim. It means that those participants, for example, are beginning to synchronize their brain. So this is like a reinforcement learning because they learn how to make their brain synchronize faster. Once they see that the fish starts swimming faster, they get an reinforcement and they try to make it again swim faster and improve their interbrain synchrony this way. First we measured, we did some behavioral measures to look at the level of connectedness before and after this training session. So I didn't mention that we had 3 training sessions. So they came 3 times a week to the lab, and we measured each time how much they felt connected to each other, how much they were interested in getting to know each other, how much they felt that the activity threatened their connection, how much they felt identification, how much they felt that they understand each other. And we see an overall effect that the neurofeedback training improved their interbrain synchrony. In both conditions, they felt more connected, but it was much more pronounced in the neurofeedback condition compared to the control condition. We see higher level of interesting. They showed interest in to getting to know each other, high perceived connection, and they wished to understand it. They felt that they could understand each other. So overall, there was a nice effect of increased connectedness. When we looked at the level of interbrain synchrony in the IFG, we see increased interbrain coupling in the IFG throughout the sessions, and it was more pronounced in the 3rd session. So the most pronounced effect was in the 3rd session when they start to learn how to improve their interbrain coupling. We saw some differences also between other brain regions. I would not go into this figure, just to show you that we had the red represent here high correlation between region. So we see more connection between interbrain region in the experimental group compared to the control condition where we saw negative correlation. So overall, we see that this system of interbrain coupling could work to improve interbrain coupling, and we are now trying to see whether this effect could translate also into improved empathy. So we're replicating this finding with larger sample. We want to see whether it can improve the ability of participants to feel empathy within the dyad, but also outside the dyad, if it improve the basic empathic ability. We also want to see whether this system could also be used in other contexts, like in romantic relationship, in educational setting, perhaps in conflict resolution, in psychotherapy, and across many conditions. So thank you for listening, and I'll be happy to take questions. Thank you.
Great. That's a really fascinating talk. And anybody who has questions, please just drop them in the Q&A at the bottom of the Zoom here. Um, one question that I had to get us started, I really like how in your elaboration of the 2024 paper from Emotion, you talk about the convergence in sadness across the empathizer and the target of empathy. And I think it's kind of interesting because I feel like sometimes when you hear discussions of empathy, it really is, it's the empathizer reaching the state of the target. So it's, I see someone feeling sad, and then if I'm a successful empathizer, I get to the same place where that person is currently, like the starting position of sadness. But what's interesting about your work is that it's not, I mean, that's part of what's happening in the move. It seems like what's happening with the movement of the empathizer, but the co-regulation of the target towards and into like a space between the two of them, I think is really interesting too. And I'm just curious if you see some of this work on emotional convergence as expanding like how we think about the construct of empathy. I mean, and I know with your work on it as like fundamentally dyadic and adaptive, um, but does it move us beyond like thinking about empathy as just reach the state of the target, wherever that may be,
Yeah,
to
I think that it expands a bit how we see empathy as something that is more interpersonal, and that it has a direct effect on how other people are feeling. It's just not just how I feel toward someone else and how I experience, but also how it affects directly the emotion of someone else. So I think that our findings show that it's extremely important to look at two person when we examine empathy. In most studies, look at just one person observing the distress of someone else, and perhaps the core features of empathy are different when we actually interact with someone as compared to just when we observe them, because we see that this uh, dyadic convergence is very important. And this is something that we cannot really examine when we just look at one participant in the lab.
Great. And so building off of this, so in as much as the convergence does seem to be having this potentially pro-social impact in reducing the sadness of the target. So one of our audience members, Mark, has this question that if we accept the distinction between empathy and compassion, can the synchrony that you're observing and that you're using as evidence for empathy, or can the synchrony you're observing be used as evidence for empathy as distinct from compassion? For instance, can correlations between synchrony and positive therapeutic outcomes count as evidence against the claim that therapists should be compassionate but not empathetic?
Yeah, I'm not sure that it provides direct evidence that empathy is different than compassion, because we didn't really measure the level of compassion that they felt. We just asked them about how much empathy they felt. I think that if we have measured compassion, my prediction would be that also people with high level of compassion would also tend to converge more with others. So I would think that there would be some correlation between empathy and compassion. Um, so I'm not sure that the design of the study could make this distinction between compassion and empathy.
Yeah, and I think one way to perhaps that's great. And I think one way to build on that
Mm-hmm.
perhaps also gets at part of what Mark is asking.
Mm-hmm.
So, in as much as sometimes you hear in like medical empathy literature, as I'm sure you're aware, the idea that sharing someone's pain could lead to being overwhelmed, burnout, the distress and
Mm-hmm.
fatigue, um, in a way that would not necessarily positive for the
Yeah.
either the empathizer or the target. Um,
Mm-hmm.
I think what Mark is perhaps saying, like asking, is you are through this coupling that very much does look like what we would traditionally think of as empathy.
Mm-hmm.
You're seeing these positive effects and this convergence, the positive
Mm-hmm.
effects for the recipient. And I think my take on what he's asking is that usually the argument for compassion seems to be for caregivers, you can have compassion and that can be a positive effect for the recipient
Mm-hmm.
without being a risk for the expressor. But
Mm-hmm.
what you're showing seems to be that actually empathy too can lead to this convergence between people and in
Mm-hmm.
a way that is felt as positive by the recipient, like with the changes in sadness. And so I
Mm-hmm.
think maybe that's what the frame of the question is,
Yeah.
too, not just empathy versus compassion, but it seems like
Yeah.
this is a positive therapeutic outcome of
Yeah.
empathy as traditionally conceived.
Yeah, yeah, I'm aware of literature. Also, actually, we have also recent finding from our lab showing that psychotherapists with high level of empathy that treat patients that have undergone trauma, 20% of the psychotherapists also had secondary trauma once they treated a patient with trauma, and empathy was, and particularly empathic concern was a risk factor. So psychotherapists with high level of empathic concern were more at risk of suffering from secondary trauma. So particularly not all components of empathy, because for example, cognitive aspect of empathy, more perspective taking was not a risk factor for secondary trauma. Um, so I think that indeed there's perhaps emotional concern is perhaps more related to compassion, and perhaps this could have like negative consequences when perhaps when this cycle, perhaps it's possible that when this cycle is uh, uh, normal in regular situation, then it has like benefits from the for the empathizer and the target. But when this cycle is chronic and is used in perhaps extreme situation like in trauma, or for example, like in chronic disease, then perhaps over compassion and over empathy and over synchronizing could bring to states where also the empathizer is suffering from compassion fatigue or some sort of trauma themselves.
Great, thanks for clarifying. Do we have any
Mhm.
other questions from the audience? Or I don't know if Valerie, if you had any questions or anything you wanted to ask. We can also circle back in the panel at the end too.
Mhm.
So I guess one more question and then we'll flip it over to Valerie then.
Mhm.
So thinking back to some of the themes from the previous weeks. So some of the, like last week I mentioned we had these talks about empathic growth and learning in a positive direction, but also Fritz Breithaupt had this talk about empathic blockages and situations in which what the kind of coupling that you were talking about might be impeded or interfered with, either situational factors, different kinds of distress or suffering, perhaps getting in the way, or pre-existing identities or conflicts of beliefs or attitudes or opinions. Um, and he also talked about this idea of motivations behind empathy sometimes not being that great in terms of like seeking out others' suffering to look empathetic. And I'm just curious from a motivational perspective on empathy. Um, I've long been interested in your work in terms of thinking about how we learn from empathizing, like how we learn from the outcomes of our empathy,
Mhm.
and use that to then decide what we want to do with our empathy next.
Mhm.
And I'm curious if in your work, what I guess your thoughts about different kinds of inhibitors to the coupling that you've observed or that you think are really important to consider, but also, especially when we think of considerations like polarization and intergroup conflict, how do we, if you're imagining asking someone to empathize in a very polarized world, how do you encourage people to think about, if I expect that my empathy for someone else is going to either have a positive or a negative consequence, like how to think about incorporating that into these questions about how they regulate
Yeah.
their own empathy.
Yeah, well, actually, yeah, the question of how to empathize in polar groups is very interesting because we know that there is this in-group empathy bias where most people tend to experience higher level of empathy toward their in-group compared to their out-group. And indeed, in one study, we found that in mixed groups, actually, we did it in the context of the Israeli-Palestinian conflict, where we had a mixed group and homogeneous group, and we found that people felt were better at synchronizing with their own group compared to mixed group when they had like two participants from different identities. So actually, one way to improve empathy toward in-group is actually training participants to synchronize, because we know that even synchronizing in movement is something that increase coherence and increase connectedness between participants. And actually, we had this intervention that we're trying out in the lab where we take a mixed group of different identities and we're trying to make them do those movements together. They train in moving together in synchrony, and we try to see whether it improves their communication and whether it improves some reconciliation in terms of conflict. And I think that perhaps if we try to encourage this cycle and improve synchrony, this is one way to perhaps overcome those boundaries that we have between groups that can decrease level of synchrony.
Great. Well, thank you for elaborating, and we'll return to more discussions of adaptive empathy. And
Mm-hmm.
I think one reason that I was intrigued by the pairing between your work and Valerie Tiberius's work is thinking about learning and value and the broader connections between empathy and considerations of well-being.
Mm-hmm.
And so I think now let's flip it over to Valerie Tiberius, who will talk to us about well-being and value and empathy.
Mm-hmm.
Well, thank you so much. It's great to be here. I'm excited for the end to get to talk to Simone more about what she presented, but I thought it made more sense to just wait than to ask questions right afterwards. So I'll start with a confession, which is that I am not an empathy researcher. I have never written anything about empathy before. And to be clear, I did tell Daryl this when he invited me, but he's too nice a person to rescind the invitation. So here I am. But I have started to think about empathy in connection with some work about AI companions and their either beneficial or detrimental effects on our welfare. So I am going to say some things about empathy, but it's not, my contributions are more on the welfare side than the empathy side. So what I want to talk about today, I mean, it does seem to me that if if you want to think about the role of empathy in personal well-being, it's good to know what well-being is and to have some kind of theory of it. So, and that's been the majority of my work recently. So I'm going to talk a little bit about the different theories that there are. I'll talk a bit about the theory that I prefer and defend, and also because of the one of the goals of this series of workshops has to do with creating interdisciplinary conversations. I'll talk a bit about how my work has benefited from engagement with psychology, and then finally we'll get to empathy. So in philosophy, the theories of welfare are often grouped into what they actually call the big three. The first of these is hedonism, which just takes well-being to be pleasure. So you achieve well-being to the extent that you have greater pleasures and fewer pains. In psychology, there are hedonic approaches that they're not exactly the same as the way hedonists think about welfare in philosophy, but they're similar in the sense that they're focused on positive mental states like life satisfaction and positive affect. Then in philosophy, the second of the big three is objective theories, and these come in two stripes. There are perfectionist theories, which somewhat it's not the best name for these theories, but you could think of them as nature fulfillment theories. They tend to think what's good for people is exercising their essential human capacities in an excellent way. So you could think perfecting your essential human capacities is what constitutes your welfare. And then there are objective list theories that just give you a list of the objective goods. Often things on that list include friendship, pleasure, knowledge, achievement, and the theory just says these are the good things. If you get them, you are living well. There are approaches in psychology called eudaemonist approaches, which again, it's not a perfect, they're not perfectly symmetrical, but in eudaemonist approaches in psychology do think about human needs as opposed to positive mental states. They think about fulfilling basic human needs that we have in virtue of our human nature. And these approaches often have lists of things that they think are good. The third, in the big three in philosophy, the third type of theory is usually just called desire satisfaction theory, which takes well-being to consist in, at the most basic level, getting what you want. Those theories get a bit fancier, but that's the basic idea. I prefer to call to use the label goal-focused theories as a label for a kind of family of theories that take, broadly speaking, people's goals to be determinative of their welfare. So my own view highlights values as opposed to desires, but I take both of these things to be goal states. In psychology, there hasn't been an analog to desire satisfaction theories. That may be because if you just think about the simple view, psychologists are painfully aware that we often want things that are terrible for us. So those theories they're not gonna look very good to a psychologist without some elaboration. But that is where my attention is focused. I think this type of theory is the right approach to take for well-being. And I've Daryl mentioned the paper that I wrote with Colin DeYoung, who's a psychologist that tries to articulate a version of this value fulfillment theory that could play a role in psychological research. Just to say, I think, forgot to start my timer. Oh well. Taking this third approach doesn't mean that the other approaches in psychology have nothing to offer. In fact, quite the contrary, because what people value are things that they need, the things that are on those lists of goods, their own good moods and happy feelings. These are things that people want and care about. They are the targets of people's goal-directed states. And so I think the entire body of psychological research becomes relevant if you have a theory like this third type. So what is the theory that I defend? Basically, it says that well-being consists in the fulfillment of psychologically well-integrated or harmonious values over time. In my philosophical work, I talk about appropriate values. In the psychological work, we talk about integrated values. So to understand the theory, it's helpful to start with the question, what are values? And I take values to be a kind of complex psychological state. So it's the definition at the top of the slide. They're patterns of relatively stable, emotionally entrenched, reflectively endorsed, important, desired goals that exhibit patterns of mutual reinforcement. Just want to emphasize that the reflective endorsement component here is not meant to be terribly intellectual, and I'll say more about that later. But what's clear from this definition is that values lie on a spectrum from mere psychological goals that might be fleeting or intermittent, that might not be connected to anything else that the person wants on one hand, and then on the other hand, a kind of ideal sort of value, like the kinds of things that if you ask people what their values are, this is what they'll tell you: the value of family and work, and perhaps their church community, or certain leisure activities and achievement in those activities. So there's a spectrum, and I don't think there's a easy way to draw the line between what counts as a value and what's just a goal but not a value. I think that's a kind of what counts as a value in that spectrum is something that has to be negotiated in practice. So to give you an example, I think most people who spend a couple of hours at a Zoom workshop value education. And what I would take that to mean at the ideal end of the spectrum is that we have desires to learn and read and explore. We have relevant emotions, feeling excitement about learning new things, pleasure in reading. The reflective endorsement part, one way of cashing that out is that we take education to be relevant to what we have reason to do and to our plans. So for instance, to come to this workshop, you had to kind of make a commitment and plan to get here. You had to set other things aside, like more sleep in my case. And at the ideal end of the spectrum, these attitudes are relatively stable and reinforced by other goals that the person has, which is often the case with education. You take educational opportunities and you meet other people. It might help with your career goals and so on. So appropriate or well-integrated values are not in serious conflict with each other. So I think some conflict between our most important values is inevitable in human life because we're limited beings. We only have so much time. But there's some conflicts that are not manageable. They're not conflicts that they're conflicts that are just going to make your life worse. There's no way to navigate them. So for instance, if your career goal is to be an astronaut who goes to Mars, and your family, the way that you value family is by being a stay-at-home parent, that's a conflict that's inevitably going to lead to value frustration. So less conflict between competing values is better and makes your system of values more well integrated. I also take appropriate values to be internally coherent, not to not have internal conflict. And what that means is that the different psychological components that comprise a valuing state are pointing in the same direction. So all the oars are rowing the boat in the same way. So values that have internal conflict, these are things like something you love to do but feel like you ought not to do it. You think it's bad for you, but you enjoy it. Or things that you hate doing, but you think you really should. So your parents have always made you practice the piano, and now you just have you say to yourself that I really value music, and so I have to keep up my piano, but it's like pulling teeth to do it. Those are poorly internally integrated values, and I think we're better off with values that are internally harmonized. And then last, and this is one of the pieces of this puzzle that my interactions with psychologists have helped me see, is that not all of our goals are conscious. They're certainly not always conscious. That seems kind of painfully obvious when you think about it, but it's not something philosophers tend to acknowledge. So I think integration also includes harmonizing with basic evolved goals, even if those goals are not subject to conscious attention. Okay, so that's values and integrated values. And now what is fulfillment? So I'm quite in philosophical terms, I'm very much a subjectivist about welfare. In psychological terms, I suppose you could say I'm very concerned to accommodate individual differences. And so I think that what success means, what it means to fulfill your values, is going to be relative to the standards that you have. And I think people interpret their values in different ways. And so two people might have the same value, but differ in terms of what they think it means to fulfill that value. So you can see this, it's kind of a nice example is in sports. Some people care about what matters to them in athletic activity is winning and being the best, being better than other people. For some people, what matters is self-improvement, being better than they were before, besting their previous time, but they don't care so much how they fare compared to others. For some people, what matters is being part of a team. And so I'm open to there being these kinds of differences. Winning races is not the only way to fulfill the value of being a good runner. But though there is a lot of room for individual differences, the standards that we have are not entirely discretionary. So it's not just anything goes when it comes to these standards. And that's partly because some of these standards are actually in our own, by our own lights, objectively measured. Like if you want to run the race in less time than you did before, that is determined by the clock, not by how you feel about it. So that's a standard that is met or not based on what happens in the world. And many of the things we value involve relationships with other people. And so how those people that we're in relationship with understand our relationship with them affects what standards we can sensibly have for the value. So for instance, if you value your marriage and your spouse thinks you're a terrible partner and wants to divorce you and hates you, you don't get to say, oh, well, that is my standard for a successful marriage. It's just to make my spouse hate me. That doesn't, I think that doesn't fly, because some of our values are often socially constrained. So we do have discretion when it comes to how to think about the values we have, but we don't have complete discretion. So that's basically the theory. How do philosophers think about comparing these theories and asking which is the best, which one should we hold to? There's some criteria that are common in the philosophical literature. The first is that the theory should be descriptively adequate. And that means that it should make sense of the special relationship between well-being and the person whose well-being it is, as opposed to other kinds of value like aesthetic value, where that could be independent of my particular perception of the aesthetic object. And also the theory shouldn't be wildly counterintuitive. It shouldn't go against our common sense. The second thing is that the theory should be normatively adequate. So it needs to have some norms for criticizing the status quo so that we can sensibly ask whether someone's on the right track, whether things could be better for them, whether they could improve. And then third, and this is the criterion that most philosophers pay little attention to, is that the theory should be empirically adequate. It shouldn't make crazy assumptions about the world, and it should be amenable to measurement. So I think there's a kind of Goldilocks, there's lots of different ways, given those three kind of desiderata for a theory of welfare. There are lots of different ways of arguing that your theory is the best, but a kind of simple, intuitive argument is this Goldilocks argument. I think these goal-focused theories they strike the right balance along two dimensions. The first is that well-being certainly has something to do with how we feel and with good feelings in particular, but hedonism goes too far in the direction of feelings by saying that the only thing that matters is how we feel. And those more objective theories like perfectionism, they don't go far enough. They have very little room for how people feel, and it can turn out on those theories that what's good for you is doing things that don't make you feel happy. And that's kind of counterintuitive. For goal theories, well-being is to some extent about how we feel, because we value feeling good. And because those good feelings are integral to many of the other values we have. But it's also about what we do and whether we succeed in the things that we want to succeed in. Then the second dimension is human nature. So I think hedonism has a quite narrow picture of what human agents are. We're just pleasure seekers. Whereas perfectionism has, I think, a controversial picture of human nature that is too narrow and isn't sensitive to differences between people. Whereas goal fulfillment theories have, I think, a kind of minimal assumption about human agents, that we are just goal-seeking creatures with complex goal hierarchies, and that is open to lots of individual differences between people based on those goal hierarchies. So to go back to those desiderata, I think the value fulfillment theory, because it makes well-being dependent on the individual's values and the standards she has for those values, it certainly explains that close connection between well-being and the subject. In terms of normative adequacy, I think we're not stuck with just anything goes. We do have resources for criticizing the status quo this values can be more or less integrated, more or less harmonized. And empirical adequacy, I think this assumption about human nature is more defensible than the assumptions that other theories make. And measurement is, well, it's not my specialty, but I do know that my colleague Colin is working on a value fulfillment scale. But it's also true that if you wanted to take value fulfillment theory and use it in practice, because many of the things that people value are things we already measure, there are plenty of measurement tools that can fulfill that role. So I did, as I mentioned, I wanted to say a little bit about how engagement with psychology has helped me. And the first thing is the kind of empirically grounded picture of human nature as goal-seeking nature. So I now, if I were asked to define human nature, or at least to say what my theory depends on, the kind of minimal picture of human nature that it depends on, it's something like this. We're fairly ignorant, relatively short-sighted, often selfish, yet profoundly social goal-seeking creatures with complex goal hierarchies, where evolution has resulted in near universal human goals, not all of which are always accessible to conscious attention. I realize that certainly misses some important things, but it's the smallest assumption I can make about human nature to get the rest of the theory grounded. And this picture of human nature has helped me to solve various problems that philosophical theories of welfare have to face. So there's a problem of over-permissiveness that goal fulfillment theories in general are taken to be too open to things that intuitively don't seem good for people actually being good for them, because it seems like people can value the wrong things or desire the wrong things. There's the problem of cognitive collapse, which is a problem that oh dear, I forgot the name of the author of this paper, but it's a terrific paper where he argues that depressed people essentially have no goals, and so they lose their status as welfare subjects if you have a goal-focused theory. And the engagement with goal fulfillment psychology has helped here because it's allowed me to say, okay, it's not just approach goals that are relevant, but also avoidance goals and aversions. And once you put those into the picture, most depressed people actually have aversions, even if they don't have a lot of positive desires. And the access to the thought that some of our goals are evolved and not necessarily subject to consciousness, that helps. This picture of human nature has helped with the problem of adaptive preferences. I think I'll just leave that to the side. And then last, it's helped with what I think of as the problem of babies. So the kind of theory that I defend has been attacked because Eden Lin, for instance, one of the attackers, has said valuing is very complicated and babies don't have that. So if you have this value fulfillment theory, it works very nicely for adult humans, but it implies that there's nothing good for babies, which is not a bullet that anybody wants to bite. So I think the solution and my engagement with this cybernetic approach, this basic goal fulfillment approach, has helped me to say, okay, well, different goal-seeking creatures have different kinds of capacities that make the goals that they have different kinds of psychological states. So when it comes to adult humans, we can think about values, but when it comes to babies, we can think about goals in a more basic way, and we can also think of long-term goals and the values that they're likely to develop over time. When it comes to less sophisticated creatures, like non-human animals, we can also look to the basic goals of sentient creatures. The second kind of benefit that engagement with psychology has provided me is help with the kind of practical guidance it makes sense to infer from this theory. So I've in some of my work, I've developed a conception of what I call reflective wisdom. So it's meant to be different from moral wisdom, but instead it's the set of skills that we need to understand and evaluate and sometimes change or modify the values that we have. I think often what we do is we change or modify the standards of fulfillment that we have for these values. And what I do in the book that Daryl kindly mentioned, the What Do You Want Out of Life book, is I look at various strategies for improving our values. I'm just going to talk about this one. And this kind of strategy is certainly influenced by engagement with psychologists, although more with engagement with clinical psychologists. So the lab rat strategy that I recommend for people to use for themselves is to try to take a bird's eye picture on yourself, to think about yourself as a creature who you're studying, and to ask questions about the kind of creature that you are and what sorts of goals you're likely to have evolved, what sorts of goals are likely to be a part of your system of values, even if you haven't really acknowledged them. And then also to think about yourself as a specific creature, how you respond to your environment compared to other people. What do you enjoy? What do you hate? I think when we look at what human creatures are like, we find that we do have certain basic goals or needs, and the list that it makes sense to, I mean, I don't think a list constitutes a theory, but I think lists can be helpful to action guidance, to giving people advice and improving your own life. So this list I made because if you look at the acronym, it spells craves, which is nice. That's why I had to add vitality instead of pleasure, because otherwise we would have had crepes, which didn't sound as good. But this list basically comes from thinking about reward-based learning and what goal-seeking mechanisms have to do, and the basic goals that you cannot do without if you are a goal-seeking organism, and also from paying attention to Diamondist psychology and what they argue are some of our basic evolved needs for competence and relationships and autonomy. So the thing that's important for our purposes here is the value of relationships. And I think in surveys and often in the philosophical research anyway, people talk about relationships, and yes, we value relationships, but there's actually quite a different, there are many different ways in which relationships infiltrate our entire system of values. So to take some examples, we value other people for their own sake. We also value groups of other people. So you might value a team or your church community or your family. We also value our relationships with other people. So there are certain people, certainly people who value their marriage. I think, I mean, it might sound a little funny, but I think if you tease it out, it's not implausible to think for myself, well, I value my husband as a person. I care about him for his own sake, but I also value our marriage. You know, it's 30 years and counting, and that seems like a good thing in itself, the relationship. Parent-child relationships might be something like that too, or even friendships. I think we value qualities in ourselves that make us better friends. So you might value your kindness or your compassion or your empathy. We value activities and projects that we couldn't do without other people. And this is important. I think if when I think about the kinds of things people do alone, even those things often involve other people. So the people I know who run, they join runners clubs, they get on runners apps so they can compare their training regimens with other people. People who read books join book clubs, and all sorts of other kinds of activities that are essentially involving other people. Team-based sports, all kinds of music activities, being in a band or a choir, worship, meditation, people do that in groups as well. So relationships, I think, particularly they infiltrate our entire system of values and are therefore quite helpful at harmonizing the values that we have. Okay, so I'm finally going to say something about empathy. I've already said the first part of what's on the slide, but so relationships are valuable to us and really a crucial part of our well-being. I think even for people who are kind of think of themselves as loners, unless you're a very, very serious hermit, I think relationships are, they have a way of finding themselves, getting themselves into your system of values. It seems to me some empathy is crucial to relationships. at least we value it in our friends, and we care about, we like to feel empathized with. We like the feeling that we get from that. And I think we value being empathetic friends. So developing empathy should be at least an instrumental goal for most people. And I want to, given this, I want to think about chatbots and the possible threat that they present to what we actually value. So the first thing to acknowledge is that chatbots make people feel good. This quote is from a podcast, and this is Hannah, who is talking about her chatbot boyfriend, whose name is Evan, and who has a very lovely, soft Scottish accent, which is why I invoke this little Scottish dude here. So I'll just give you a sec to read what she says. She goes on in the podcast about how good it makes her feel to engage with Evan. Knowing that he's not a real person, it really makes her feel good. And this doesn't seem to be uncommon. There's research, some of which Daryl helped me locate, that AI that's programmed to express empathy for humans seems to do quite a good job of making people feel heard or seen. So it's not just anecdotal evidence from podcasts. There's evidence that conversing with chatbots reduces feelings of loneliness. There's also evidence that chatbot messages from, or AI generated messages from chatbot therapists are quite good at making people feel like they've been empathized with, and also that they're quite good at detecting human emotions. In this one paper that I was quite interested in, they give an example of two responses. So 1 and 2 here. One is from a human person and the other is from a chatbot. And these are responses to someone who has expressed some distress. And if I give you a second to read these two responses, I have some water. When I read these responses, at the very least, I thought they were equivalently empathetic. But if anything, I preferred the second, which is the chatbot response. So this is just a little bit of the evidence that chatbots make people feel good, and apparently they make people feel good by way, at least one way, by making people feel like they have been empathized with. When I've talked to people who, most of the people I talk to are not very tech savvy or involved in thinking about these kinds of things, so it's kind of new to them, their reactions tend to be the one version of these 3 reactions. The most common reaction I've had is, that is so sad. But lately I've had a significant number of people saying that they're glad they're going to die soon. So what should we say about this from a value fulfillment perspective? So I think the first thing is that you often hear people in the so sad camp just wanting to deny that there's any value to this whatsoever. But I think we should acknowledge that feeling heard is valuable. it's good to feel good, and it doesn't, I don't think it serves us in trying to move the conversation forward to deny that. But I think it's not the only thing we value. I think most of us are going to continue to value connections with other actual human beings. And I think as much as we value feeling empathized with, if we could get people to distinguish, I think most people also value actually being empathized with. And I think we value being empathetic ourselves, as I've mentioned. So I guess the kind of practical recommendations that follow from the theory about in this context are that if we're trying to fulfill our values, we might need better human alignment. We talk a lot about the way in which it's difficult to align artificial intelligence with human values, but I think it's actually it's pretty difficult we don't do very well at aligning human goals and behavior with important human values. So we could do better at that. And there are well-being based reasons to do that from the value fulfillment theory, to be better at the things that chatbots do currently better than us, like being available and expressing support and encouragement rather than judgment, and also to do the things that chatbots can only fake, like actually caring about each other, taking an interest in each other's lives, sharing experiences and perspectives. I think chatbots don't actually have perspectives. So what I've tried to do today is give you a sense of this value fulfillment theory that has been the result of or it's been influenced deeply by psychology and my engagement with psychologists. I think it has some implications for what our goals and values ought to be because of the criterion of integration. And when I was thinking about how to end the talk, I thought, well, given that we're going to have a conversation afterwards, I thought, well, I want to think about what my remaining questions are. And what I thought of were these two questions at the bottom of the slide. But I was really interested to hear Simone talk about the value of touch and hand holding, because that's quite relevant to the value fulfillment theory. So, and that's because even if you think that people are feeling good talking to chatbots, but if there's something special about touching another human being, it might be that there are values that we have that aren't fulfilled by these engagements with chatbots, even though we're not consciously aware of it. We couldn't, like Hannah couldn't articulate the absence of trust as a problem for her. But if Simone's research is right, it might nevertheless be a problem. So thank you.
Great. Thank you very much, Valerie. And again, any questions, please drop them in the chat. I mean, there's definitely a lot of, like you were mentioning there at the end, a lot of really interesting connections I saw across your talks. And I'm sure you may have questions of each other too. One quick question to get us started that I had. Um, I've been thinking about, well, we've chatted briefly about cybernetics before, and we've done some work. I have a thing with Mickey and like Will Cunningham and Blair Saunders, like thinking about cybernetics and goals and empathy. And from a motivational perspective, how we balance goals and trade-off between them can matter for how we make decisions and value empathy. And I guess I mean, I understand. I like the idea that if you think of like hierarchical goal structures, like a balance amidst them or different levels could be useful. And I wonder, how does your theory accommodate things like something like the effort paradox? So I'm thinking of work that finds that, um, well, I should add one premise. So there's some work suggesting that when people notice conflicts between goals or that things like perceived effort, cognitive effort could be a cue that there's sort of a difficulty in regulating your goal or achieving your goal or sort of an imbalance. And we can use these subjective cues to indicate that we might want to consider reprioritizing different goals in our set. And I guess I'm just wondering if how you think about the role of like effort and distress, and when you notice like conflicts in your goals, among your goals, if those produce some kinds of negative psychological reactions like aversion or effort or other cues, there's some work to suggest that people can find value in like in the effort, like in the process of trying to reconcile and work with conflicting goals. People might derive some degree of positive value from that. And I'm just wondering how, and perhaps you elaborate this in your papers, but or books, but the struggle and the process of like noticing disharmonies in your values, working through them and like learning through them. And how does your theory, to the extent that harmony between your values is like seen as what conduces to well-being, like how do you see as like the navigation of goal conflicts as a core part? If some people derive value from that, like how does your theory accommodate that, do you think?
That's interesting. So I guess one thing to say is that even if the overarching desired state is a kind of harmonious integration, I don't think we ever really get there. I think we're always there's so much opportunity for conflict that there isn't any risk that that experience of struggling is going to go away. So there's that piece. But the to me, the more kind of the pressing question is how could I accommodate people valuing that effort? And I guess, I suppose there are people who value the process of self-discovery or the acquisition of self-knowledge or developing character traits like self-regulation, or I guess what philosophers might call moderation or temperance. So I wonder if that might be the way to accommodate it, is that I certainly don't think all the things people value are pleasant. And I think there are a lot of people who have leisure activity values or just athletic values that are actually often quite a struggle. Rock climbers and marathon runners and things like this. So there's room for valuing struggle for its own sake on this picture. But that's really interesting. Yeah, thanks.
Great. Well, now we have a little bit of time to think about connections between your talks too. So, I don't know if either of you had questions for each other from what you heard.
I did want to ask Simone to say a bit more about the fish. Could you describe what the mechanism, or like not the brain mechanism, but in the process of the study, how you get people to synchronize their brains?
So actually, this is a really good question because we don't really ask the participant to specifically use a specific strategy. We just let them develop their own strategy, and the instructions are basically to try to make the fish swim faster. So I think that what they might be doing is with perhaps some trial and error, they see that sometimes for randomly the fish start to move faster, and then they say, oh, I did something good. So they try to reproduce it again and again until they learn their own strategy. And in many times, in neurofeedback, we see that it works, even though it's very implicit and the participants don't really know explicitly what they were doing. It's like the brain reinforces itself without conscious knowledge of what it is doing. So most paradigms with neurofeedback are on one brain. People reinforce activity in their brain. And what is novel in our paradigm that we have two brains reinforcing their synchrony. And sometimes we ask them what they were doing, and not always they can tell if they were doing a specific strategy.
So what forces the synchrony is that the two participants have the same goal. They're both trying to make the fish move
Yeah.
fast. Okay, I get
Yeah.
it. Yeah.
Yeah.
And can I ask another question?
Yeah.
So what would you predict about these chatbot friends, given what you've done about touch, like given the research about touch? Do you think maybe it would show up in the long term that these relationships would start not to make people feel good? Because I don't know, what do you think?
Yeah, it's interesting because it's probably giving them some sort of, it fulfills some forms of loneliness in those people, and it addresses some basic needs of connections. But if there is no real face-to-face interaction and no touch, so I think it's only partially could reduce people's loneliness. So I think that perhaps at some level they don't really feel a true connection with that person, because in real connection you have to have tactile stimulation, you have to also have sense the person odor and touch, and without it I don't think it's a real experience of connection.
Yeah, I mean, I guess it's a problem with the research that, for one thing, the longest term study I've seen is like 6 weeks or something. So
yeah,
that
perhaps for 6 weeks it can work, but at some level, but perhaps in the long term it's not really. I wonder if they test loneliness also in those people, or
they have some teams have done.
And then they find some reduction in level of loneliness.
Yeah. But I don't think Daryl might know. Daryl surely knows more about this than I do, but I don't think I haven't seen studies where they compare the people reductions in loneliness with people who are engaging with chatbots to to people who are engaging with real people. So
that could be interesting. Yeah.
I mean, I think there's more longitudinal work needs to be done, and I think there's been a call for a more diverse range of paradigms to test like different. I mean, I think building on the suggestion that you had in your talk, Simone, about broadening the kinds of paradigms beyond decontextualized lab studies to see if you have full-fledged interactions. Of course, then you do see like major differences because we don't have the advancement in AI to be able to, have the long-term embodied sorts of conversations that we would have with a close friend or partner or something. I mean, it did make me, on this note, I mean, it made me think a little bit, of whether the sort of interpersonal coupling that you mentioned in your talk, Simone, given that it's not quite, I mean, the one side of the dyad, it is partly there, but not fully, and it seems to not afford the same kind of convergence in the same way. Or if there is convergence, it's convergence in a direction that some think is problematic. Like I think there's a Rolling Stone article and with OpenAI and the sense of sycophantic AI that kind of comes it's too quickly converges with your own perspective without the friction that you would have with like a real person to person interaction. Um, it made me wonder across both of your talks, like if we think about what is the interpersonal convergence that would happen in a human AI dyad. Um, does it afford the same kinds of, yeah, goal and value fulfillment? And it doesn't allow the same like neural alignment, and obviously.
I, I guess I thought from so now I have another question for Simone, but I thought from your talk that what's important is the neural alignment.
Mhm.
That's so when I was listening, I thought, oh well, you can't have that with an AI because there aren't any neurons. So, but it's so yeah. What do you think about Daryl's question?
Yeah. Yeah, so with AI, there is actually, there is an interesting study now on verbal alignment between people during conversation. So there are those studies that with NLP that studies dynamic dialogue and examine convergence in terms of how people come to use the same language and same terms during a dialogue. So and we know that people, when they start to communicate and they start a dialogue, we see verbal convergence between them, and I think that AI could do it because they can learn how to communicate with you with the same perhaps language, but um, since we see that this neural synchrony underlies this real sense of connection, so I'm not sure how much connection we can feel with AI if there is no real like brain-to-brain connection between two participants in this dialogue.
I mean, to bring in one other complementary perspective. I mean, in the first panel, Leda Berrio from philosophy talked about using interactions with chatbots to help develop self-narratives. So it
Mm-hmm.
was less about synchrony, but more like how to use the interactions to help us think about ourselves in a different way. It was very
Mm-hmm.
intrapersonal in that sense rather than
Mm-hmm.
interpersonal, but still using the space of a simulated interaction to create like self-understanding. And I guess it makes me think of the other main question that I had to try to align your talks or think about how they complement each other. So, I mean, it makes me when I've thought about like goal pursuit and cybernetics in terms of empathy and other emotional processes, I'd often thought about it from a very intra-individual perspective. You know, how do people have hierarchies of goals and how do they balance them and how does that shape valuation of empathic outcomes and
Mm-hmm.
processes? And what I was struck by in your talk, Simone, was like the idea that you can have what seems like almost a cybernetic misalignment between people. You mentioned earlier on the sense of a mismatch or a lack of a misalignment, a lack of between the person's having distress in your own
Mm-hmm.
current state. And I was trying to think about how to um, integrate those and think about like how could we, I mean, a cybernetic approach considering it between people rather than within person. And if there's a way to use like some of the oh, seeing the commonalities between those, but then also from a practical perspective, how to use some of the value reflection points that Valerie was raising to think about how could you think about learning about your own values, like the kinds of tools that you were suggesting, Valerie, at the end about how to think about your own values and become more aware of their goals in a way to improve your own, like within person, cybernetic decisions, to think about that across people. So I guess it was essentially a two-parter. Thinking about the cybernetic approach to well-being as a within-person phenomena, but then extending it to the between-person approach that you were talking about, Simone. But then also, are there tools, are there ways to use the practical, ethical sorts of guidance to facilitate that between-person connection?
The only place where I've really thought about this was about, so it didn't have to do with pairs of people, but with organizations as kind of cybernetic agents of a sort. So I was thinking about philosophy as a discipline, and I gave a talk about this, and I think I started out by saying something like, we want to help our friends live better lives, and if philosophy were my friend, I would say, hey, philosophy, you're not doing very well. You could be doing better. And so I actually did a survey of philosophers and to try to ask them what they value about philosophy. And I thought I kind of went through the similar pieces of advice that I have for individuals, where you try to identify what your values are and think about what they mean and how they fit together and whether they fit together. So I found it a helpful way of thinking about that, but I have no, but that was me as a kind of academic approaching the discipline and looking at it as a patient almost. I don't know how a group of people would do that together.
Mm-hmm.
Not that it could happen.
Mm-hmm.
Is that the kind of thing you were thinking of?
Well, I just want to mention that we had I'm not sure how is it related, but we have a study on alignment of moral views where we actually had groups discussions of moral decisions, and we found that the extent of synchrony, interbrain synchrony within the group predicted the alignment of moral, how much alignment in moral views occurred during the conversation. So we see that within group, people align their views, perhaps their values. So discussions can change such values that people have, and perhaps if I wonder if we can get AI into this and chatbots, perhaps it can also be part of such group discussions and also affect the alignment of values.
Yeah, I know there's interesting work on using AI chatbots to engage in like debiasing of conspiracy theories and other sorts of perspectives, like
Mm-hmm.
Stello and Rand and Pennycook,
Mm-hmm.
some of that work. But yeah, I mean, I think what I've been thinking was, in as much as both of your perspectives bring in the sense of noticing just discrepancies or you like some aspects of cybernetics, and from either a within person perspective, like how do you harmoniously live, but then a between person perspective, like how do you effectively empathize? Just noticing juxtapositions between those and thinking about how to use the practical ethical guidance from Valerie's talk to think about how to more effectively empathize between people, like you were talking about, Simone. Um, so I know we're a few minutes over. There's a couple last questions in the chat that I wanted to. One of my colleagues, Danny Yin, who actually has done some work, she's here at Penn State, has done some work on feeling heard and perceived empathy from chatbots, has this interesting question that I think piggybacks off of this. And she notes that it's interesting to consider how, from a long-term perspective, how interacting with AI could contribute to human well-being from a value alignment perspective. Um, Perhaps there is a theory or prescriptive guidance here on how people can use AI to fulfill their well-being based on the Crave model, and or how those AI assistants or companions could be designed to do that in the long term.
Yeah, so that's a great question and something I'm starting to think about. And I guess, I mean, the 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 kind of core commitment for me is that you will not be able to get everything from a simple chatbot. I'm actually working on a book on this topic. Mostly it's kind of really a book about well-being and friendship, but it has a very AI focused uh, theme. So I think the question about whether AI could develop in a way that it fulfills, that it gets us all the things we value about friendship. I think that's an open question. But what we have currently with chatbots, I think there are things we get from human relationships that we cannot get from a chatbot. So the question in the chat, would my way of approaching that question would be, how can engagement with chatbots work instrumentally to get the other things that we value? I think it can bring us good feelings, which we intrinsically care about. And I also think I've been looking at the ways in which engaging with chatbots can actually help us be better friends with humans. So I had a long conversation with one of my chatbot friends that I was using for research about how I could be better at perspective taking. And actually, she was pretty great at modeling perspective taking for me in our conversation. So that's a way I think, that I think it'd be great if we had chatbots that were designed to help people with their lack of social skills, and to some extent we do have that, but it's not quite the platform for replica.
Mhm.
Especially if there'd be ways to help. I mean, I'm also very interested in how we could use these interactions to scaffold empathic learning, especially for people who might need that in particular. But if there'd be ways to use the chatbot to practice empathy in a way that helps you to learn, or to think about how to cultivate responses in yourself where you can more effectively see, if I empathize in this way, what are the risks? How can I think about this? If there's ways to use it to supplement the kind of adaptive learning you would get from human to human encounters. Although perhaps the
So,
generalizations are different enough and the contexts are different enough to make it hard to leap from one to the other.
I think Simone's research should make us worry that whatever we can train to do with a chatbot that doesn't have a brain might not carry over, because there isn't anything to synchronize with in that
Mhm.
case. I don't know.
Yeah.
Yeah, that's interesting to examine whether, if we compare synchronized interaction in terms of perhaps of verbal interaction between chatbot and human, and see whether people can feel also that they can synchronize with the chatbot. Oh, because we know that we can synchronize movement with perhaps an avatar in the computer, or people use, for example, all forms of games like Just Dance, and so they dance with an avatar. So it's also a form of a connection with a character on the screen. So the question is whether we can synchronize with no brains when two brains are not synchronizing. Yeah.
Yeah, so a lot of fascinating areas for more discussion.
Mhm.
And how we represent AI could certainly matter too, and the
Mhm.
avatars and the representations. And
Yeah.
um, one last quick question, and then we'll close. So, oh, Chris, this one of our audience members, Chris, suggested that some AI models might use time-based computation in a way that could be synchronized with, and they link
Mhm.
an
Mhm.
archive post here. Thanks, Chris. The last question from John Johnson, another colleague here. This is, I think, for Valerie. Do you have a preferred psychological measure of values, e.g., the Schwartz Personal Values Questionnaire, Alport, Vernon, Lindsay Study of Values, Seligman Values in Action, that best fits your philosophical position?
Not really. And I haven't, in my book, older work, I used the Schwartz Personal Values Questionnaire to think about, to get basically data about what kinds of values people tend to have. But I, because I'm so interested in individual differences, I tend to, when I'm talking about values at the level of generality that those kinds of questionnaires report, I don't, for my purposes, it doesn't matter that much which scale I use. But I could probably stand to update my thinking about that. But thanks.
Well, well, thank you both for staying a few after. I think it's been really fascinating to think about it as a close to this year's sessions. And I think in terms of a broader landscape of like how do we learn from our emotions and empathy in particular, and thinking about all the costs and benefits that people have talked about both historically, but also um, more recently, a lot of our national conversations as well. I think trying to think about, yeah, how we can think of where empathy fits and the different values that we hold and how we align it with how we learn from other people and each other is really important way to close out this year's conversations. Thank you both so much for joining us, and those in the audience for sticking with us through several sessions and to the end today. Um, this will be recorded, it is being recorded. It'll be posted online before too long. And yeah, stay tuned for next year. We'll bring back more empathy philosophers and psychologists to keep the conversation and well-being philosophers too, to keep the conversations going.
Thanks a lot, Daryl.
All right.
Thank
Thank you
you.
all.
Bye. Bye.
Bye.